So the population I chose was the gang population as far as my population health project. And yeah, so just the description of the population, I just put it's a group or society of associates, friends, or members of a family. Within the gang, there's a defined leader, and within the internal organization that claims control over a territory and a community. The members of the gang engage either individually or collectively in illegal and or violent behavior. The size of the population was a little hard to find. Like locally, there's within the city of Ogden, there's about 300 members. And then you can see statewide it gets larger. Nationally, they think there's about 33,000 different types of gangs and estimated 850,000 members total. Internationally, I couldn't find any information, just different names of gangs. But it's hard because gang members really are only counted once they get into prisons. And I only know that from experience, from family experience, but I know that the officers there look at their tattoos, and based on their tattoos, you can kind of tell what gang they belong to, and then they record them from there, and that's how they get their numbers, because gang members don't really volunteer that information. It's not like a census or anything. So social determinants of health, I just put, poverty, low education. It's kind of like when you grow up in it, it's all you know. You don't really see a way out. Low education, like a lot of the schools in the area aren't very good. They don't have a lot of money, and a lot of the teachers can be kind of jaded from the types of students they get, so they may not provide the best education. And also they could be run down from the politics of everything. Like not having enough money can lead to no supplies, and you can't really educate students in that way. Prejudice, I think that there's a lot of ways people think about gang members and their families. They could think that oh, well, they can just, get themselves out of it. They choose to live like that. Or they may have preconceived notions about gang members and who could be a gang member. And this leads into racism based on your skin color. People may look at you weird or how you look. They may be scared of you, how you dress. That goes more into prejudice. But racism, I think, follows along these lines. Substance abuse, there could be, underlying mental illness and just depression and anxiety from living on the streets and living the ways of the streets and losing friends and family to violence. So this could lead to substance abuse to cope. Access to housing. Housing isn't really great in these areas. It could be expensive. Gender inequality. Usually females in these instances are treated less than, and that's just the culture of the way it is. Like you're kind of there to be looked at, to do things. You can run drugs and stuff like that, but you don't have as much power as like a man does. And occupation and job availability, like I said, a lot of these people aren't educated. And yeah, they may try to get a job, but the money isn't as good as like selling drugs or weapons. So they may look into there probably is pressure to join a gang, but yeah, jobs aren't really available out there. Contributing factors, I put like young initiations because gangs really target the younger kids, even as low as like 11 and 12, because they're easy targets, and a lot of them grow up poor and they want to help their family, and they think this is a way to do it. Culture, like I said, the culture of the streets. It's just what you do. If you're born into it, it's what you live every day. So it's the culture in which you're brought up in. A lot of these gang members have parents that were in gangs or have been involved in criminal activity like drugs or selling weapons. So this is what they grew up knowing. Again, poor opportunities, low job opportunities. It just comes with the territory. I don't know. I feel like these kind of all run together, but like no education, low housing, poverty, low income. Like, again, if you don't see a way out, like a gang really seems like the best option. Maslow's hierarchy, I put physiological can be met just because like if you're in a gang, you have money coming in, so you can afford food and shelter, either in each other's homes or you're just taken care of in that way. Love and belonging, it's a sense of family. It's your friends become your family, your associates become your family, your own family members can be in the same gang as you. So this can kind of bring that love and belonging. Self-esteem, like if you are accepted by the crew, like it leads to higher self-esteem. Unmet, I put physiological as well because, yeah, you have like the basic stuff like the sex, the food, drinks, shelter. But as far as your health goes, that's put at risk every day because you could get shot and die. So, and that runs into safety. Safety isn't really there because you're always on the lookout for, if someone's going to shoot at you or stab you or jump you to initiate you, things like that. Self-actualization, I think it's hard for anybody to get there, but I think it's harder for someone who's in a gang. Health outcomes, I just put acute trauma because, like I said, violence is huge. Chronic disease, they're not really going to a primary physician, so they're not really looking out for their health, and death is always at their doorstep. Communicable diseases, I put STIs, pneumonia, TB, Hep B, Hep C, HIV, and AIDS. I think this is very prominent, but especially in the prison system. I think these can easily be spread. Hep B and Hep C, just because of the drug use, stuff like that. Yeah, and they're not going to the doctor, so. Non-communicable diseases, I put stroke, heart disease, cancer, diabetes. They're not, really health conscious. They're not going to watch what they eat. They can't afford, a healthy meal, so they're probably just eating not so good food, and this can lead to things like heart disease, which then could lead to stroke and cancer and all that. So, and diabetes as well. They're probably not taking medication because they can't afford it. Self-care and self-harm, anxiety, depression kind of run with the course. Like you don't know when your last day is going to be because of the life you're living, and your family could be targets, so that could be like a huge cause of anxiety and depression. Violence against themselves or others, gang initiations are huge, so violence against other innocent people is very prominent. If they want to rob you, if they want to get money for things or steal other people's guns or cars to commit crimes, that's going to happen. Suicidal ideation, like I said, once you're in a gang, there could be no way out unless it's like kill or be killed. So they may choose to just end their own life. Overdose is huge because of substance abuse. I don't know. I kind of feel like this is the same question, but risk for harm by, I guess, violence against others, like I said, is huge. Gang initiations, you jump somebody, you jump someone in a gang, it's just the culture. You can get your house broken into because they need drug money. or they need weapons to commit crimes that won't lead back to them. You can have your property broken into. They may steal things like cars to do drive-bys, and then they'll dump the car. Yeah. All right, and then my references. Okay.